Dogs across the country are reportedly coming down with an unusual respiratory illness. More than a dozen states have confirmed cases, but no one knows exactly what is causing this. To discuss what vets do know about what parents of pets need to know, we are live here with local veterinarian Dr. Angie Zinkeson, who's our little friend here that I'm going to kidnap.
This is Yogi, my dog.
Oh, so it's your dog.
Yeah,
so I
sorry.
can't run off.
He would drop me for a nugget, but
chicken nuggets. Okay.
Yes.
All right. So talk to me about this mysterious illness.
Yes, the biggest thing I have to say is do not panic. It's kind of the only thing I can compare it to is when COVID came out. We didn't know a lot about the disease, and so extreme panic went over everywhere. The things we know about this disease are one of three things. It's either a new illness. It's either a combination of canine respiratory illness, or it's something that's basically heightened because a lot of dogs historically in the past few years haven't gotten the vaccines they've needed.
Is this, how is it affecting them specifically?
Correct. So a lot of dogs present with a deep, harsh cough, okay? And immediately people think, oh, and veterinarians think it's kennel cough. The problem is kennel cough is a misnomer, so they don't necessarily have to be in a kennel. So basically, you can have two dogs that are at a park and within 10 feet of each other and transmit the disease. So the kennel cough, like I said, is a misnomer. Now, these dogs are unique in the fact that when they are trying to isolate whatever it is, it's not coming up the typical pathogens that are seen in kennel cough. There's a bacterial and viral component. And so what's happening is the medications we typically use, the antibiotics we use for kennel cough, they aren't responding to them. And a lot of dogs will all of a sudden develop pneumonia, ocular discharge. And so it's one of those things where, there's one set of people who say, oh my gosh, this is a virus. There's another set that says it's a bacteria. It's a virus, it's a bacteria. We just don't know a lot. But yeah.
Yeah, and are certain breeds more prone to this?
Yes, our smush nose breeds are more prone to it because if they develop pneumonia, then they're going to have more difficulty breathing.
Are they passing away? Are they?
There are a few cases, and that's where I think the shock comes, because a lot of people are fearing, oh my God, my dog's going to pass away. But the important thing to remember is if you notice any of these symptoms, to go see your veterinarian immediately.
All right. Of course, think about this. It's the holidays. So some people may be going on vacation and they're thinking of boarding their furry friends. And so I wonder, what are your thoughts on boarding right now?
As much as I hate this for boarding facilities to say, or grooming facilities, it's best to, the more dogs you have in an area, the more likelihood you have for respiratory disease. And so maybe having a house sitter come during the holidays, because like I said, the diseases are very contagious. And if it's just an upper respiratory, well, those can take them down pretty quickly as well.
Okay, and so how widespread is this? Let's talk about, has it actually arrived in the greater Memphis area? That's Tennessee, Mississippi, Arkansas. Are you hearing about cases in this area?
We are not. I think the closest is probably Georgia or Florida. However, I will say in the past 6 months, and I've talked to some of my colleagues at my general practice as well as at the emergency centers, and we have seen an uptick in canine upper respiratory diseases. So we're seeing dogs that are maybe have what we call kennel cough, and they aren't responding to antibiotics like they normally would within a week. It might be a couple weeks. Again, I don't want to elicit fear, but at the same time, I want people to be cautious.
Okay, and so usually we tend to get what happens in neighboring states. So we can kind of look at what's happening there and follow what's happening.
Correct. I mean, the biggest places right now are Oregon, Washington, and California. Those are the biggest cases they're seeing.
All right. Can we dig a little bit deeper into the symptoms just so that before you leave, I want to just talk about what we're looking for and then what we need to do, the steps that we need to take. Okay, correct. So you said a cough.
Cough, nasal discharge, ocular discharge, eye discharge, lethargy, difficulty breathing are all the big signs. I mean, I would say even with a lasting cough, to go see your veterinarian.
Even sneezing, because I mean, dogs sneeze all the time.
Absolutely. I mean, occasional sneezing is fine, but I'm talking like a deep cough that just isn't getting better. Occasional cough, a cough that I would say is lasting beyond 24 hours.
Okay, and then of course you don't want to spread it to others, so when you bring them in, any tips?
Well, a lot of vets, if you let your vet know, hey, my dog's coughing, and a lot of times they'll put them in a specific room for that.
Okay.
Yeah.
All right, and that's the number if anyone wants to reach you, ask questions, or oh, Yogi's getting really comfortable here.
I think he's your new side man here.
Okay, so we have a little mascot. Thank you so much
Yes,
for coming in and sharing all this information so we can keep our little pals safe. Okay.